Welcome to a special episode of Beyond the Roundup. Today we'll be talking about big news coming out of the European Union in regards to the fight against COVID-19. Slovakia becomes the first European Union nation to formally approve ivermectin for both prophylaxis and treatment for COVID-19 patients. We'll talk about what happened and how we got here. And so, from TrialSite News, I'm Adrian, and our episode starts now. So, while here in the US, the NIH recently updated their stance on ivermectin from against the use of the drug, ivermectin, except in clinical trials, to a more neutral tone of neither recommending for nor against the use of ivermectin to treat COVID-19, overseas, in Europe, the first European Union nation to authorize ivermectin as a treatment for COVID-19 falls to Slovakia. The Slovakia Republic's Minister of Health has formally registered ivermectin as an approved prophylaxis and treatment for SARS-CoV-2, which is the virus behind COVID-19. On January 26th, Health Minister Marek Krajci granted a permit for the unregistered drug, as ivermectin had already been in use on a compassionate basis over the past half year. The antiparasitic drug was authorized by the health minister after a formal request from Professor Ivan Schreiter, the chief expert for infectious disease with the Ministry of Health of the Slovak Republic. Now, this move was, in large part, the result of networks of healthcare professionals, journalists, and other healthcare activists who have been working diligently to raise awareness as to the mounting efficacy data in the context of COVID-19 pandemic. Now, this authorization is conditional. The registration is valid for a 6-month time period for hospitals and ambulatory care for the indication of prophylaxis and treatment of patients with COVID-19. The medicine will also be available at licensed prescription pharmacies. And so, with the authorization on hand, doctors received the news that they could proceed with formally authorized prescriptions of ivermectin both in hospitals and outpatient. So now let's talk about the path to approval in Slovakia. We had a chance to interview a biochemist researcher from University of Toronto who was originally from Slovakia, Ondrej Halgas, who has been actively involved with a network organizing and lobbying for the drug's approval during the pandemic. Now, Halgas shared with us that he has been collaborating with physicians such as Dr. Pierre Corey and Paul Merrick of the Frontline COVID-19 Critical Care Alliance, or the FLCCC, and he has also been in touch with a physician group in Germany that treated the elderly at a nursing home with ivermectin, which, after treating about 100 patients with the drug, the rate in one case series dropped to about 5% mortality when compared with a national average of 25 to 30%, which represents a significant difference. Of course, this isn't the result of a formal study, but nonetheless represents more real-world data points. Now, Ondrej Halgas expressed some concerns about potential supply challenges. He explained to TrialSite News that unlike in other European Union countries, such as Austria, in Slovakia, ivermectin was available only for animals and as a cream for humans. Now, there were a few exceptions to this, of course. As an example, one hospital in the nation's second-largest city, which had been influential in the importing of the drug under some kind of waiver prior to this authorization of the drug for the use against COVID-19. So back to the potential supply issue. Well, this latest edict by the health minister now allows for the importation of the drug. Now, while doctors and hospitals have been importing the drug from Austria, and even as far away as India, it is not yet clear how the country's predominantly national health system will work to efficiently and effectively import the drug now that its use is authorized on a large scale. Presently, the country has 3 payers, including one national payer and 2 private sector groups. And so, on this issue of the potential supply problem of the drug, Halgas, in a recent interview in a press release by Pravda.sk, was quoted as saying that Slovakia should not wait for the World Health Organization to recommend the use of ivermectin against COVID-19, and that by doing so, there would end up being a shortage of the medicine on the market. Which, it seems that his wish was granted, as Slovakia now has authorized the drug for COVID-19. Now, when Halgas was asked how health agencies approach ivermectin, he stated that the World Health Organization is investigating the results of this drug and that it will take some time for the organization to issue a recommendation. He also mentioned that doctors from the FLCCC Alliance and Dr. Andrew Hill, who is involved in data analysis for the World Health Organization, also reported their results to the U.S. National Institutes of Health, and that the NIH even recently rescinded its opposition to the use of ivermectin last August. And that, according to data presented before the NIH, the deployment of ivermectin could save 60,000 lives a month in the United States and 250,000 lives worldwide. So, when Halgas was asked what does the use of ivermectin look like in patients, he replied that the dosage is based on the approved dosage of ivermectin for the treatment of parasitic diseases such as Norwegian scabies, and unlike other drugs that were originally considered, ivermectin helps at all stages of the disease, and that it is clear that the sooner the better. He went on to say that it is a basic principle of medicine to treat a disease as soon as possible. The longer one waits, the harder the treatment. And he said that it was incomprehensible that official recommendations for early treatment of COVID-19 in developed countries did not yet exist. Now, during our conversation with Ondrej Halgas, when asked how he now felt that ivermectin has been approved for authorization for use against COVID-19, he expressed pride that his home country was able to become the very first nation in Europe to formally approve this drug as a complement to vaccines and other treatments. And so, we here at TrialSite News have been watching the trends and reporting on the developing situation that is ivermectin. And it seems to us likely that more nations will follow suit and authorize this drug for use as prophylaxis and treatment targeting COVID-19, at least for the duration of the pandemic. And as always, we will keep you posted on this story as it continues to develop. And that, my friends, brings this episode to a close. And as always, it's a pleasure to be here with you all. From TrialSite News, I'm Adrian, and this has been an episode of Beyond the Roundup. I'll see you all next time.